Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through September 30th, 2021. Today, I'm going to answer a question that came in this week, which is what should we understand about breakthrough infections? It's something people talk a lot about. What do I need to know about it? And then I'll give a quick update on the current status of the pandemic. So a breakthrough infection is really a COVID-19 infection that occurs in someone who's been fully vaccinated. It's important to understand it is not a side effect of the vaccine. I got my booster shot yesterday. My arm hurts. That's a side effect, but it's not a breakthrough infection. And it's not an infection caused by the vaccine. There are some live virus vaccines, which COVID is not, that can cause disease, but that's not the case. This is simply a case of COVID in someone who has been fully vaccinated. And generally, your risk of a breakthrough infection is related to two things: how effective the vaccine is at preventing the disease and how likely the vaccinated person is to be exposed to the disease. That probably makes sense. So in terms of how effective the vaccine is at preventing disease, folks are often surprised to learn that many of our current vaccines are not 100% effective. In fact, I don't know any that are. About 97% of fully vaccinated people against measles are protected, 90% of people with 2 doses of polio, 88% of people with mumps. And you think, well, that's not very good. But if you look at global deaths of children under 5 based from vaccine preventable diseases in the last 30 years, it's gone down by 2/3. So even though a vaccine may not be 100% effective, if enough people get it, it's going to save lives. If you look at measles in the United States, there's that red line. The vaccine was licensed in 1963 until a year or so ago when we had the anti-vax movement out on the West Coast. We saw very, very few cases of measles in the United States. But it's important to remember that around the world, 140,000 people die every year from measles. So this is still a serious disease, and we're very fortunate that we're protected from it. If you look at polio cases and polio deaths, you see a phenomenal impact of the vaccine, such that the images that we used to have of polio are now long gone. According to the CDC, fully vaccinated people who are vaccinated against COVID may still get infected, but their infections will likely be much less serious. They tend to be less severe, and they're less likely to be hospitalized. And studies, this is from the CDC, studies so far show that vaccinated people are 8 times less likely to be infected and 25 times less likely to experience hospitalization or death. So let's look at some regional data that helps us really see this. So recently I took all the counties, Northeast Tennessee, Southwest Virginia, and I calculated the vaccination rate, and then I weighted the whole region. Okay, so Sullivan County makes up about 1/5 of the population, so they got 1/5 of the weight. And basically, as it turns out, about 43% of people in our region are vaccinated against COVID, fully vaccinated. Yes, and that's pretty low. It's embarrassingly low. But what percent of people who are hospitalized in the ballot health system? As of yesterday, only 5.9%. You'd expect 42.9% if the vaccine didn't have any effect, but you can see it significantly reduced hospitalizations, it significantly reduced admission to the intensive care unit, and it significantly reduced intubation. All right. So the risk of being in the ICU has been reduced by over 95%, and the risk of being intubated by over 96%. So you can see the phenomenal impact that the vaccine has had in this region. All right. But the second thing, and this is a little bit harder for people to understand, is the risk of a breakthrough infection isn't just the effectiveness of the vaccine, but also how likely someone is to be exposed to the disease. So some time ago, and how likely someone is to be vaccinated, is someone who's vaccinated to be exposed is related to 3 things: how widespread the virus is in that community, how infectious the virus is, and how many other people are vaccinated. So let me show you this graphically. So say you have 100 people in a community. There are 4 types of people, right? Some have been vaccinated, some have been sick and now have natural immunity, and then some are susceptible. Now, there are a few who are thought to be immune. In other words, they've been vaccinated or they've had the disease, but they are in fact not. And I show those with red circles. So let's take a situation where you have a low rate of exposure or a virus that doesn't spread very easily. You get a few initial infections, a little bit of spread, and then it stops. And so you may see none or very few breakthrough infections. But what about at the same community if you have a virus with a high rate of exposure or a virus that spreads easily like the Delta variant, what you see is it begins to spread very quickly, and you get a significant number of breakthrough cases. So how likely someone who thinks they're immune from vaccination or natural disease is to get a breakthrough infection is related in part to the virus and how widespread it is and how infectious it is. But it's also related to how many other people are vaccinated. So let's take this same community and increase the number of people that are vaccinated, shown here with black dots. Now, if you have a high rate of exposure, there's still relatively few infections. All right. So it doesn't make a lot of sense to people, but actually for someone who is vaccinated, their risk of getting a breakthrough infection is actually related to how many other people are not vaccinated and also how widespread the virus is. So how widespread the virus is in our community, it's been pretty widespread recently. The Delta variant we know is very infectious. And of course, at this point, only 43% of our population is vaccinated. So that's what we need to understand about breakthrough infections. If we want to control them, we can't control the Delta variant. We can't make it go away. We don't have a treatment. The best thing we can do is get as many people vaccinated as possible. In terms of the pandemic update, just very quickly, we're quickly approaching 5 million deaths worldwide. You see this undulating pattern. It does appear to be coming down now, this latest wave, and hopefully, with each wave seems to be slightly smaller than the one before it, but still almost 60,000 deaths last week. In terms of the week-to-week increase, it's fluctuated over time. The last week it was a 1.2% increase globally. That's the lowest it's been, in fact, in recorded history. So hopefully we're seeing the pandemic slow down. But again, as we've seen before, it will recur in other places and at other times. In terms of the US, we are appearing to see the slowing down of the current wave. We've had 700,000 deaths in our country, 14,000 deaths, over 2,000 deaths every day last week. And the rate of growth is about 1.5% last week, so slightly worse than the world overall. And then in Tennessee, it's not quite clear. Maybe we're coming down in deaths. We're certainly coming down in cases. So I suspect the death rate will start coming down. 15,000 total deaths, a 2.9% growth rate last week. And then in the ballot health service area, they're down to 313 admissions. That's great news. But as you can see, that's still one of the highest levels they've had in history. So while things just seem to be slowing down, there's no reason to give up our efforts to vaccinate and to control this pandemic. The best thing we can do right now is get as many people vaccinated as possible, as quickly as possible. There's a great deal more information about COVID-19 on the College of Public Health website. If you're sharing this video with anyone, please let us know their email address. We'd be happy to share it with them directly. As always, I'd like to thank Dara Young for editing, producing, and posting this video. If you have any questions, like the breakthrough infection question, it's important for me to know what you don't understand, where you have questions, because if I can address them, I'll try to. Sometimes I can't. But thank you very much for your attention, and be well. Look forward to seeing you next week.